We have a few questions. First question is for Dr. Bilal. It's a very interesting question. How to diagnose NAFLD with the fibroscan, MRI, or biopsy? As ultrasounds in Pakistan or everywhere in the world shows 80 to 90% of the fatty livers with the different grades, and many of them have normal ALT and AST. So it's been asked by Dr. Mufti from Shifa International. And what are the next step and how do we follow?
So, excellent question. 315, session 14, is the talk about diagnosis and evaluation for fatty liver disease. So, this is the same thing we'll be discussing about.
All right.
So, if Dr. Mufti, please attend the talk.
Thank you very much. Then, so next question is for Dr. Ko from Professor Altaf Alam. Can we select non-cirrhotic NAFLD patients for HCC screening by adding genetic test markers, which increases risk of HCC like PLA3?
Sure. So the question is, what tools do we have now that we can utilize to try to identify the people without cirrhosis that we should also be screening for hepatocellular carcinoma in addition to our cirrhotic NASH patients? So yes, so I do not use PNP-LA3 yet. It is an association, like so many things with NAFLD, to tailor. But if you have PNP-LA3, that is somebody that you should be looking to see if they have more significantly advanced NASH than perhaps you initially ascertained on your evaluation. But if that person with PNP-LA3, for instance, were to have slight splenomegaly, or AST was a little bit higher, or the platelet count was a little bit lower, even though my evaluation did not show cirrhosis, I would absolutely tell that patient you should get an ultrasound and an AFP every 6 months. And when you tell these fatty liver patients that you're going to do this to be most conservative, it's been my experience up to now that the patients do not mind coming in to getting those tests done. Ultrasound is not a particularly invasive test.
The next question is for Dr. Sanali Shah. As IBS is most common in NAFLD, so do we really need to use probiotics? Do we really need to give probiotics or change in the diet?
We are already using probiotics for IBS, not because they have got NAFLD or NASH, but for treatment of IBS, yes, we're using probiotics, but still a long way to go before we go on to use probiotics for NAFLD.
Thank you very much, sir. So I would like to take remarks from the chairpersons.
I think first of all, I must congratulate the organizing committee for such a nice arrangement and a very good attendance in the early morning session. And the first talk by Bilal was excellent. It's always very impressive, and I love to hear always. And Hassan Shah touched about on the emerging trends. We come to know many new things about the treatment, which will be the future of NAFLD. And overall, it was an excellent session.
So now I'll move to Dr. Javed Farooq. Okay, madam.
Thank you very much. All excellent talks. Professor Palku has given us an incentive when to start screening our patients with NAFLD, because when we tell them that please reduce your weight, take proper diet, walk, and if we give them awareness what is going to happen with their liver, and they have to go for screening regularly for HCC, they will be more convinced. And as far as Professor Abbas, he has given us an excellent talk regarding diabetes and NAFLD and new drugs which are going to come, which are going to be there for obesity and GLP-1 agonist. We don't have any experience with this drug, and he is going to be the supervisor for us because this is a new drug for us for it to use in diabetes. Thank you very much.
Thank you. On behalf of my co-chairs, it gives a great pleasure to thank all the speakers and the audience for such an excellent session. Believe me, this was one of the best sessions I have ever attended over the last 1 decade. Thanks organizers and thanks all speakers. Thank you very much.